Endodontic flare-ups. So it is an acute exacerbation of an asymptomatic pulp or periapical pathosis after the initiation or continuation of the root canal. So normally the tooth is asymptomatic, but once we started or initiate the root canal treatment, it produces some pain. So this is endodontic flare-ups. So incidence is 1.4 to 19% in inter-appointment flare-ups produces. So most commonly affected tooth are maxillary lateral incisor and mandibular first molar and retreatment cases, and young females under 20 years are most commonly affected. Next, moving on to predisposing factors, it has two main factors, significant factors and other factors. In significant factors, shaping errors, cleaning errors, pulpo-periapical status and retreatment cases. So in shaping errors, over instrumentation, incomplete or under instrumentation, improper shaping technique. And cleaning errors, irrigant extrusion, and pulpo-periapical status and retreatment cases. These are the significant factors. And other factors, one is anxiety and another one is preoperative history of pain. So these are the predisposing factors for an endodontic flare-up. So let's see individual factors. Significant factors. Shaping errors. The first one is over instrumentation. It is an iatrogenic error resulting in forcing debris into the periradicular region, resulting in an acute inflammatory response. So it is iatrogenic error and forcing debris into the periradicular region, it produces endodontic flare-ups. It is a first shaping error, over instrumentation, and the second shaping error is incomplete or under instrumentation. Here they provide the pulpal remnants for the persistence of microorganism. So this microorganism produces the virulence factor. This virulent factors asymptomatic infection to become symptomatic infection. So endodontic flare-up is occur due to the incomplete or under instrumentation. It is a second type of error, shaping error, and third type is shaping technique. So improper shaping protocol that may cause extrusion of the debris is a significant cause of an endodontic flare-up. So improper shaping protocol, it is also produces extrusion of the debris into the periradicular area, it causes endodontic flare-ups. So the important point here is step back shaping technique, greater tendency to extrude the debris into the periradicular region than the crown down technique. So endodontic flare-up most commonly occur in step back technique. It is very important. Than the crown down technique, step back technique produces more endodontic flare-ups. Next, moving on to cleaning errors. Here irrigant extrusion, the standard regimen of irrigation is 0.1 to 5.2% of sodium hypochlorite with 17% EDTA. It is very important. And in endodontics, every procedure including irrigation of pulse space is a passive nature. Definitely it is a passive movement. And inadvertent extrusion of irrigant beyond the periapex stem, sodium hypochlorite accident. So sodium hypochlorite goes beyond the periradicular region is called sodium hypochlorite accident. What are the signs of hypochlorite accident? Patient complains of severe and excruciating pain, especially when they are not under LA. If they are under LA, they complaints of irritation at the periradicular area. These are the two important points. So sudden severe excruciating pain and sudden flooding of the canal with the blood and tissue fluids. So sudden flooding of the canal with blood and tissue fluid and ballooning of the tissue in the area and swelling of the soft tissue. It is the signs. So sodium hypochlorite, it is a hypertonic solution. It enter the periradicular tissue, it would open up the capillaries and minute blood vessels. So flooding of the canal with blood is physiological reaction to dilute the concentration of the sodium hypochlorite. That's why blooding of the canal is occur. It is physiological reaction to dilute the concentration of the sodium hypochlorite. Next, moving on to management. In management, definitely the patient has to be informed about the accident. If the patient is not under local anesthesia, we have to give block anesthesia for pain control, and bleeding from the canal is continually allowed until the defense physiological mechanism is stopped. So the canal is flooded with normal saline so that the accumulated blood comes out and level of the pain is decreases. So we have to flood it with a normal saline in the canal. So sodium hypochlorite can dissolve it is very important, it dissolves both the normal and infected tissue. Post sodium hypochlorite accident, the periradicular area remains inflamed and tissue are necrosed. So it is preferred that the patient is immediately placed on parenteral antibiotic therapy and analgesics because of the necrosed and inflamed area in the periradicular area. We have to give parenteral antibiotic therapy and analgesics, and call the patient for follow-up periodically to assess the rate of the healing in the event of an uncontrolled flare-up. Some endodontics would prefer to consult a general surgeon and physician to administer steroids in a planned manner. So mainly we have to give vitamin therapy during the recovery phase. And mainly immature teeth. What is immature teeth? With the open apex. Care should be exercised with ensure that the irrigant is not extruded into the periapical. Clinical note, we have to remember this point in clinical practice. So always use passive irrigation and never force the irrigant into the pulse space. So don't force your needle don't force the irrigant solution into the pulse space. So sodium hypochlorite should be handled carefully as it inadvertent seepage under the rubber dam. If leakage under the rubber dam, it produces multiple ulcers and painful inflamed gingiva. It is very important. So we have to check the rubber dam isolation, and the recommended endodontic irrigation needle is, it is very important. Endodontic irrigation needle recommend is 30 gauge side vented close ended needle. 30 gauge side vented close ended needle passively placed 3 mm short of the working length in a posterior teeth and 1 mm short of the working length in anterior teeth. So to avoid flushing of the canal beyond the constriction, keep the needle passively fitting into the canal. So do not wedge it against the root canal wall. That's why we use side vented close ended 30 gauge needle. Certain clinical situations require special irrigation precaution including open apexes and particularly in the young patients. And definitely we use normal saline should be used to flush out the sodium hypochlorite. So normal saline should be used to flush out the sodium hypochlorite. So these are the important points we have to remember in sodium hypochlorite accident. So the important points here is standard regimen of irrigation used routinely is 0.1 to 5.2% sodium hypochlorite with 17% EDTA. If sodium hypochlorite goes beyond the periapical region, it produces sodium hypochlorite accident. So this patient is an example of sodium hypochlorite accident, showing the discoloration and swelling. Next, moving on to pulpoperiapical status. It is another factor producing endodontic flare-up. Here, the tooth that acute alveolar abscess have a higher incidence of flare-ups. So in vital pulp, that is fewer flare-up. In acute alveolar abscess, most commonly higher incidence of flare-ups. And next, moving on to retreatment cases. It has a higher incidence and greater tendency to push the necrotic debris apically during the treatment. So retreatment cases have the higher incidence because they are greater tendency to push the necrotic debris into the apical region. So other factors here, anxiety and preoperative history of pain. So anxiety, if a patient expect pain to occur during endodontic treatment, there is an increased likelihood of increased amount of pain will be perceived following completion of the subsequent treatment. So we have to manage the anxiety reduction for anxiety reduction, and preoperative history of pain, definitely there is an impact in the, so definitely it produces impact on the follow-up procedure. So preoperative history of pain and swelling have the higher incidence of the flare-ups. So next moving on to mechanism of endodontic flare-ups. Here microbial infection and periapical inflammation produces two conditions. One, it produces progression of the disease. Moving on to next stage. And another one is local adaptation response. Here the asymptomatic phase where disease is present but without progression. So disease is present but without progression. So here we start the initiation of the root canal treatment. The introduction of irritants, that is microbial byproduct irrigants and medicaments and altered tissue proteins, it produces severe inflammatory response. So this severe inflammatory response produces endodontic flare-up. So we have to understand the concept of endodontic flare-up. So previously there is no symptoms. Once we started the procedure, symptoms are produced. So next moving on to management of flare-ups. First one is anxiety reduction. Next one is behavioral intervention and occlusal reduction and pharmacological measure, antibiotics, NSAIDs and acetaminophen and long-acting LA are given. So in occlusal reduction, we have to reduces the occlusal portion of the tooth to prevent the tooth-to-tooth contact. And pharmacological measure and antibiotics and NSAIDs and acetaminophen is mostly used for this condition, and analgesics brufen plus para is most commonly given to the patient. Question: predisposing clinical condition for endodontic flare-up. Predisposing clinical condition for endodontic flare-up. Option A, acute periapical abscess. Option B, acute apical periodontitis. Option C, asymptomatic necrotic pulp with periapical lesion. Option D, pain and swelling since the treatment. So here the answer is asymptomatic necrotic pulp with periapical lesion causes endodontic flare-up.